So I want to talk to you a little bit about the VOCs. So the VOC we call is a variant of concern. These are this is the COVID virus that is going through mutations. By mutation we mean that the virus, when in any particular time and in any particular place, when the virus goes through such a widespread circulation in population, all viruses, including the COVID-19 viruses, goes through changes. By changes, we call it mutations, which is in the genetic sort of makeup of the virus, which in most cases doesn't mean much, but in some cases it can be more virulent, it can cause more illness, it can cause more quicker illness, and it can lead to progress to more severe outcomes. So currently in Saskatchewan, we are following and monitoring very closely 3 different types of variant of concern. One that we call the B117, which is the most dominant variant of concern, actually originated initially in the UK, but then it spread around the world, and within a very short period of time, we saw cases popping up in different parts of Canada, and including in Saskatchewan. It is still a very dominating strain. The particular feature about the B117, which is the UK mutations are the variant, that it is 60 to 70% more transmissible. So if a normal COVID required 15 minutes with somebody in a closed environment to acquire that infection, in the case of B117, it's just a casual contact. So just sitting with somebody in an indoor environment without mask is enough for you to acquire or contract the virus. So that certainly has been very closely monitored in Saskatchewan. We also have some South African variant, but lately we are seeing the P1, which is the Brazilian variant. So that one is particularly been strictly monitored and watched. So anybody in Saskatchewan who comes positive for the COVID-19 virus is automatically tested or screened for these variant of concern. Initially the time was a little bit longer, but now we are finding that results very quickly. So we would know very quickly which of these COVID cases are what type of variant of concern. So the nurses and the medical officers and the public health team, the doctors, whatever is diagnosed or screened positive, take very immediate action. And in terms of contact trace, we want to find out who were that person sitting with, living in a closed environment or an outdoor environment, how long was the exposure, and then offering every single individual, whether it's a close contact or a non-close contact, we offer them immediate testing. And we keep monitoring them for quite some time. And those monitoring guidelines, how the case needs to be monitored, how the close contact needs to be monitored. That is a constant evolution in terms of the available emerging science. So in First Nations, we have seen mostly the UK variant circulating currently, and as I mentioned earlier, because of the mobility of our communities and people travel back and forth between communities, interprovincial, and also some international travel, those variants spread very quickly and also have triggered many outbreaks in First Nations communities. So we have been in constant communications with the chief and health directors on the emergence of these VOCs in the community. So the day a VOC is diagnosed to me or reported to me, I immediately call the public health team on the ground. I give a heads up to the chief so that they can take appropriate measures, and the response is quick and the cases are contained and doesn't lead to further spread inside the community. So that has been the approach all along. We have seen that, as I mentioned, that the science on vaccine, the science on the virus is constantly evolving and constantly changing. So it's really hard. It's really get hard sometimes for the public health team or for the people on the ground to follow these rapidly changing information. But the system and the health from the health system perspective, the information flow from public health officers, like from the medical officer to the community, has been very quick and quite quick sort of turnaround in terms of follow-up. Another important dimension of the VOC is that people are concerned that the available batches of vaccine, for example, the initial batches of vaccines were the mRNA vaccines, Moderna and Pfizer, and then other vaccine came along. So around the world, these vaccines are being given or administered to people with different strains or different variant of concerns. The good news is that majority of these vaccines are effective if everybody in each location is immunized. We will see less and less of these emerging strains or these emerging variant of concerns. So we want to maximize the number of people vaccinated within this month, so that we can see in June and July 80 or 85% of our communities are immunized, so that we can have a safe summer and also a safe fall. If we see that there are people are hesitant about the vaccine, people are not making those decisions in the right time, and we have pockets of unvaccinated people in the communities or around the communities, certainly will jeopardize the response to the pandemic. Also, we may see more and more emerging variant of concern other than these three that are currently circulating. And if there are pockets of unvaccinated people in future, if that pockets grows and we leave those people unvaccinated, we will see more variant of concerns that will be hard to control, that will be hard to contain. So that's why it's really important that we take every opportunity and invest every effort this month and the next month to maximize the number of people against these circulating variant of concerns in the communities.
Yeah. So are the variants more deadly?
Yes. So if appropriate precautions are not taken and the virus is not contained, and particularly in the scenario that you are facing a VOC like the UK or the South African or the P1 or any other New York or other Californian variant, certainly it can, depending upon also your unique immunological conditions. Everybody in different age group with different sort of chronic condition have a very different response to the virus. So if you are diabetic and if you're on medication, in those situations, the vaccine seems to be working really well, and people tend to develop very robust immunity. So in all sort of chronic conditions, people with infectious diseases, HIV, people who are cancer survivor, in all those situations, the vaccine seems to be working really well. And even for pregnant women, for women who are breastfeeding, for all sort of autoimmune diseases, chronic conditions, the vaccine seems to be perfectly working well in those individuals. It may take a little bit more longer time than the usual healthy people, but it does help in terms of preventing the severe outcomes, the hospitalization, the deaths. And also, if you are vaccinated, the chances of you spreading it further is very less. So we have seen in other countries that people may still be infected because no vaccine is 100%. But even after the vaccine, if you get exposed to the virus or any other sort of variant that perhaps the vaccine wouldn't be very competent against, still the vaccination provide that cross immunity to reduce the severity and the hospitalization and progressions to the intensive care node. It does help a lot in that sense. And some people may have a mild infection, some may not even notice it. But it can happen, but usually vaccination is very effective, and it does help putting a stop to this pandemic.